Hey, new and expecting moms. Let's talk about something incredibly important, but often overlooked: bleeding after childbirth. Some bleeding is totally normal, but knowing when it's too much can be life-saving. This serious condition is called postpartum hemorrhage, or PPH. So, what exactly is PPH?
It's excessive bleeding after delivery. It can happen right away, within the first 24 hours.
Which is called primary PPH, or it can happen anytime up to 6 weeks later,
Which is known as secondary PPH.
While it sounds scary, and it is a leading cause of maternal emergencies,
The good news is that it's highly treatable if caught early. You might be wondering why this happens.
doctors often use a simple way to remember the main causes,
Called the 4Ts.
The first is tone. This is the most common reason, where the uterus doesn't contract down properly after delivery. The second is tissue, meaning a small piece of the placenta was left behind. The third is trauma, which refers to tears that can happen during childbirth.
And the last one is thrombin, which involves blood clotting problems.
Certain things can increase your risk, like a very long or very fast labor, having a large baby or twins, or having a C-section. But here's the crucial part: PPH can happen to anyone, even without any known risk factors. That's why every new mom needs to know the warning signs.
Please, listen to your body and seek urgent medical help if you experience any of these symptoms.
Are you soaking through more than one large maternity pad in an hour? Are you passing large blood clots, maybe the size of a golf ball or bigger? Is the bleeding heavy and just not stopping?
Do you feel dizzy, faint, or like your heart is racing?
Is your skin pale, cold, or clammy?
Do you feel overwhelmingly weak?
Trust your instincts.
If something feels wrong, it probably is. Heavy bleeding is never normal. When you get help, doctors act fast.
They might start with a uterine massage, give medications to help your uterus contract, or provide fluids, and even a blood transfusion if you've lost a lot of blood. If there's retained tissue, they'll remove it, or they'll repair any tears.
In rare cases, surgery might be needed to stop the bleeding. Early action is the key to a good outcome. Once you're home, keep an eye on your bleeding.
Rest as much as you can, stay hydrated, and don't skip your postnatal checkups.
If your bleeding suddenly gets heavier, don't wait. Call your doctor or head to the emergency room immediately.
Never feel embarrassed or like you're being a bother.
Your health is the top priority.
Postpartum hemorrhage is a serious risk, but being informed and acting quickly can make all the difference. Share this with other moms you know.
For more tips on pregnancy and postpartum safety, make sure to subscribe. Thanks for watching.